welcome. You're watching the Health Talk session by Yashoda Hospitals. National Vascular Day is observed each year on 6th of August to raise awareness about vascular diseases. These conditions are on rapid rise in our country, and if unrecognized or inadequately treated, can lead to life-threatening conditions and disability. So let's know more about peripheral vascular disease and the importance of addressing this global health issue in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. Devender Singh, Consultant Vascular Surgeon and Endovascular Surgeon from Yashoda Hospitals, Somajiguda. Welcome to the program, sir, and so good to see you again.
Thank you.
So let's begin with the significance of National Vascular Day and importance of this global issue, which in fact is causing a significant burden on our healthcare system.
Well, as a vascular surgeon, 6th August is a very special day for us, because on 6th August 1994, few of the very eminent surgeons, they sat together with a vision and mission, and they formulated this Vascular Society of India. The need because of the disease burden. So much of population suffering with the peripheral vascular disease, neglected, amputated, and they were dying because of the complications. Keeping this thing in mind, they formulated this Vascular Society of India on 6th August 1994, and we have come a long way. Almost we are entering into the third decade. With the advancement and a lot of improvement in the diagnostic as well as therapeutic modalities, unfortunately, still what we see and what we treat is just the tip of the iceberg. What we don't see, what we don't treat is the rest of it. So this is a very special day in terms of educating the people, maybe in the form of awareness, to tell them that peripheral vascular disease is much more common than coronary artery disease. It is much more common than stroke, heart disease, and cancers. Well, for this vascular day today, on the 6th, this year we have a theme: walk a mile to live with a smile, prevent amputations, and we are definitely working on it so that India should be free of amputations. Amputations, as we know, it's a very tragic and traumatic event for the patient, for the family, relatives, and for the society. So our main focus is to prevent amputation.
So according to most recent estimates, about 1 lakh Indians get below knee amputations every year, which I think that's a quite large number. So as of today, what is the global scenario and where does our country stand, doctor?
As I mentioned, this peripheral vascular disease, the prevalence is much more higher. Unfortunately, we are not aware of this. We are aware of coronary artery disease, heart disease, brain disease, stroke, other things, but unfortunately we are not aware that the population suffering from peripheral vascular disease is much higher. And as rightly you have said, the rate of amputations is phenomenally very high. In India particularly, since we are the capital of diabetes, unfortunately in Telangana and Andhra Pradesh, we see the maximum number of diabetic, and so there is no reason that we should not see more and more diabetic population. Every 22nd, one limb is lost, and by the time we will finish our discussion of 15 minutes, 60 limbs will be amputated. And mind you, this is only because of diabetes. We do have other risk factors. We have hypertension, coronary artery disease, we have road traffic accident where the people are losing their leg and going to go for an amputation. So overall, this global incidence and the prevalence of amputations because of peripheral vascular disease is significantly very high.
So as you've mentioned that peripheral vascular disease is as common as coronary artery disease or stroke. So what are some of the facts about peripheral vascular disease that we need to know, doctor?
See, peripheral vascular disease, we must understand that it's a polyvascular disease. That means if the patient who has coronary artery disease or who has cerebral vascular disease, they will bound to have peripheral vascular disease also, and vice versa. If the patient comes with peripheral vascular disease, we should definitely investigate them for coronary artery disease as well. So it's a polyvascular disease. and it is so prevalent that we have to pick them at a very early stage, because if we pick them at very early stage, probably we will be avoiding a lot of complications, morbidity and mortality as well. So a family history, very strong family history, patient suffering with coronary artery disease, patient suffering with cerebrovascular disease, kidney disease, patient who has got vascular risk factors in terms of diabetes, hypertension, those who smoke, those who take alcohol, sedentary lives, and obviously the obese people. They are the people who probably would have more risk of having peripheral vascular disease. It is indeed very simple to diagnose these patients. It doesn't require high-fi investigations. Family history, clinical history, in terms of if you ask them whether they have pain on walking, what we call is claudications, is a typical of vascular disease. They will have numbness, they will have color change, they will have rest pain. So these are the patient, clinically we can make out that patient is suffering from vascular disease. And the most important is the clinical examination in the form of palpating the pulses of the patient. If the pulse is there, that means it doesn't have a peripheral vascular disease. If the pulse are not there, they are bound to have some kind of a obstruction in the circulatory system, and that is how we can diagnose without taking much of the time and without going for a high-fi investigations.
So as you know that most of the cases are detected at a later stage, because most of us tend to ignore the foot ulcer, assuming it to be trivial. So how challenging is this scenario, and how do you tackle this in your clinical practice, doctor?
That is where the concept of awareness and this National Vascular Days come. As we know, this is one of the most neglected, I would say, a field and area where small ulcer in a patient with diabetes will keep roaming here and there, because we don't understand that diabetic patient will have macrovasculopathy and microvasculopathy. Sometimes they will have palpable pulse also, but in spite of that also they are going to have underlying microvasculopathy where small blood vessels will get blocked. So these are the patient, diabetic patient particularly, we have to be very careful. It is definitely a kind of a challenge for us, because we do see patients, but they do come at a very late stage. Sometimes these patients, they will be misdiagnosed, they will be referred to a neurophysician, and probably they will be investigating in terms of some kind of a disc prolapse, sciatica, and they'll be roaming months together, sometimes years together, having basically a peripheral vascular disease. So most of the patient who comes to us in a late stage, but now our society is a robust society, we've been working very hard, and with that probably the awareness has come. Definitely it's on the track now, and basically it is the awareness. We have to aware the patient so that we can get them, pick up them in a right position, so that we can manage them nicely without facing challenges.
So as you know that amputation is towards one end of the spectrum, what are the other risks which are associated with peripheral vascular disease, doctor?
Death and disabilities. Sudden death due to pulmonary embolism. If there is a clot in the leg, that can travel to the lung and probably patient can collapse any moment. We are seeing these cases, particularly after COVID. We have seen so many examples. Otherwise young patients, they are doing otherwise very fit, they are doing gym and other things, maintaining diet and so, but still they are collapsing. All of a sudden they are collapsing. The main reason is a clot which travels to the lung and the heart, and that is how. So death due to pulmonary embolism, death if there is a rupture of a large aneurysm. Aneurysm is nothing but it's a ballooning of the blood vessel. So death and disabilities. Disabilities, as we have discussed, peripheral vascular disease, or it can be a disabling disabilities in the form of paralysis. When there is a probably block in the carotid artery, patient may get a stroke, and then they will have these kind of disabilities. So disabilities as well as death apart from amputations are very scary and disturbing.
So discussing about treatment part, doctor, what are some recent advancements that you have witnessed in these years in this specialty, doctor?
When I started, it was a department of vascular surgery. We used to do a lot of open surgeries. Vascular surgery has evolved now. It has become vascular and endovascular surgery. That means minimal invasive surgeries. There are set of patients, there are set of populations who has been having multiple comorbidities. So they are not really fit for major procedures. Anesthesia is a risky affair for them. So these are the set of patients where I think we can go for minimal invasive procedures in the form of angioplasties, putting a stent, and again maintaining the blood flow. From endovascular surgery, now we have moved to vascular sciences. So vascular surgery, endovascular surgery, and now vascular sciences. We probably, the independent branch, we can manage patients not only by surgeries, not only by minimal invasive surgeries, but as well by best medical therapies. There are many patients who probably not fit for surgery or any endovascular procedure, or otherwise they don't require, if they come very early, they don't require any procedure. For those are the set of people, population where I think we can go for best medical therapies. And now we are independent to tackle these patients medically, surgically, and endovascularly. So this is, I would say, a biggest kind of a improvement, and now there is a significant amount of improvement in the diagnostic modalities as well. Earlier we used to depend upon color Doppler and probably a kind of a simple angiography. Now we have superb angiography suite, we have CT angiogram, MR angiogram, we definitely find out more and more lesions in the body and can definitely do justice to the patients.
So the purpose of this day is to raise awareness about vascular disease across nation and to provide support for those living with this condition. So before ending this episode, Doctor, what message you would like to give to our audience out there as far as peripheral vascular disease is concerned?
Peripheral vascular disease patients are neglected. They need your support. Well, these are the patients, if we can pick up them very, very early, probably the treatment becomes very easy. As I mentioned, 90% of the treatment remains medical therapies as well as lifestyle modification. We have to pick up these patients having vascular risk factors. Now we have to understand what are the vascular risk factors. Patient having diabetes, hypertension, obese, sedentary lifestyle. So these are the patients with family history, patients with underlying coronary artery disease, cerebrovascular disease. So these are the patients where I think we have to be careful. We have to put these patients into the screening program, and once we put them into the screening program, probably we can pick up them early, and that is how we can manage them without major procedure. I would definitely stress upon lifestyle modification, because exercise therapy is one of the brilliant therapy for the peripheral vascular patients. It's a tonic for the blood vessels. Having said this, I definitely would also stress upon the fact that we have faced probably the deadliest or darkest side of our profession in the form of treating COVID patients. We have seen a lot of death and disabilities because of COVID. The most common cause for this death and disabilities in the COVID patients were inflammation of the blood vessels, and that is how the clot will get formed, and that clot will travel to the lungs, heart, and then patients will have sudden collapse. We are going to face these challenges in future also. We must learn from our experience, and only way to protect is we have to keep ourselves fit, and we have to probably go for an exercise. So walk a mile to keep our life safe, simple, happy, and that's my last message.
So thank you, Doctor. It was wonderful having you here on our episode today.
Thank you very much.
So this brings us to the end of this episode. Hope this episode was informative on the topic peripheral vascular disease, and do join us for the next week as well. Until then, take care and stay healthy. Thank you.